number of pain sites is an important one. So if Grace comes into me and she says, I've got neck and shoulder pain, I've got some low back pain, I've got knee pain, she's someone who's at far more risk. If you sit back for me here. So we want to look at some areas that are richly innervated, and one of those is the jaw. So if we're talking about headaches, for example, we know that the more pain sites we have in the body, the more likely we are to progress in our headaches. So if Grace comes in and she says, I just have headaches, and they're twice a month, she's super safe. If she starts saying, I'm having 10 to 14 headaches a month, she's in a high risk of developing chronic daily headache or chronic migraines, where it's 15 headaches a month, or more than 15 headaches a month, more than 8 migraines a month. The problem with that is that a migraine can last 72 hours. So yes. You could have someone who basically, for 3 days at a time, is having, 24 days a week, 24 days a month, is having a headache and migraine. So the jaw is an important one to look at as well. Richly innervated. And is that sore at all?
No, not really.
Good. And I'm just going to have you open your jaw for me, please. And again, open. Yeah, great. Now, there's been some interesting research with this with pain.
So what are you palpating here?
Just looking at feeling for clicking, popping,
yep.
And then obviously feeling for pain around the mastoids. Yep. And then the other place we want to look at is up around the temples. So is that tender there at all?
No.
Good. And here?
No.
So there's been some interesting research looking at when people have temporomandibular dysfunction, what is the likelihood that develops? There's a strong relationship between TMD and headaches, and TMD and body pain. So we talk about these pain systems as being distinct. You know, pain from the head and neck is going to go into the trigeminal system. But actually, when one system is on fire, the other systems tend to start smoking as well.
Yeah.
So I think osteopaths do quite a lot of work on jaws as well.
Yes. Yeah. Yeah.
I think there's a lot of credence and a lot of credit to it. I would say that one of the criticisms of chiropractors is that we often think that it's kind of C1 down. And then if we miss the stuff above C1, then you've made some issues. So when we look at neuromuscular examination, the big things that I think both professions could do better is looking at eye and head movements. So we've got the visual system, we've got the vestibular system.
Yes.
So the brain uses your eyes, ears, and feedback from your body. So visual system, vestibular system, proprioception, to build these sensory maps of your body and your environment. Mm-hmm. So to understand who you are, where you are, and how you interact with things, you have to have these systems working well. Your brain uses these systems to compare kind of what is the sensory environment now, and I compare that to my previous experiences to make predictions about the future. So if we have changes in the visual system or vestibular system, then we know we're going to have changes in spinal tone. So when we're looking at neuromuscular examination, if, let's say, Grace, if you could slump forward for me and just round your shoulders. Or you obviously have lovely posture and don't know how to round your shoulders. Flex them forward like that. When we see a patient like this from a mechanical point of view, it can be very easy just to say, oh, okay, you've got increased flexor tone, reduced extensor tone, you know, bad posture, we just need to try and make you do this. But we could adjust her back every day of the week. But if we don't recognize that maybe she has a vestibular issue, so the vestibular system is your chief extensor tone.
Yeah.
And so a lot of our patients are going to be here, and if we ignore the fact that we've got poor visual system, poor vestibular system, then they're going to keep slumping down. Yeah,
and strangely enough, my guest on last Monday, 2 days ago, was talking about vestibular rehabilitation. We're running a course on it next year.
Yeah,
and because of course there's a real skill to being able to analyse that vestibular system before you can get onto the rehab.